Hello everyone, I am Dr.Shiju Abraham. I am an ENT surgeon working in Aster, Ghanim. Today I am going to talk sinusitis in a nutshell. So what is sinuses? Sinus means spaces. So there are spaces in your skull bone which are called the sinuses. There are 8 of them. Depending upon the bone which the sinus is present, it is named accordingly. It is present on your cheekbones, that is the maxillary bones. There are 2 sinuses, those are called the maxillary sinuses. Between your eyes there is ethmoid bone, so the space in the ethmoid bone is called the ethmoid sinuses. On the frontal bone it's called the frontal sinuses, and behind your eye there is a sphenoid bone, so space in the sphenoid bone is called the sphenoid sinuses. These are air filled cavity, so only air is present in these sinuses, and this is lined by a mucous membrane which secretes mucus, and this mucus through a narrow opening comes into the nasal cavity and goes into the throat. So sometimes this narrow openings can get blocked due to the swelling of the mucous membrane, and the swelling can happen due to infection or allergies. Once the sinuses are blocked, there is accumulation of the mucus, which there is an opportunistic bacterial invasion which changes this mucus into pus and causes infection of the sinus mucus lining. So this is called sinusitis. So what are the symptoms of sinusitis? It generally starts with like a common cold when there is nasal stuffiness, and in the acute sinusitis, if the cold symptoms last more than 10 days, 2-3 weeks, it is called acute sinusitis. More than 4 weeks or more than 120 days, if the symptoms persist, it is called chronic sinusitis. So the treatment for both would vary. So that is why it is classified accordingly. Now the symptoms, as I said, there could be nasal stuffiness, it could be nasal discharge, nasal running nose, headache, a feeling of pressure in the head, cough, catarrh, postnasal drip, bad taste in the throat. So these are the symptoms of sinusitis. And how do we diagnose sinusitis is by a simple procedure called the nasal endoscopy. When the patient comes to the OPD, we do an endoscopy to check whether the sinus openings are inflamed, there is mucosal discharge. We see the anatomy of the nose, if there is any deviation of the nasal septum. We see on the sides there are 3 bones for every human being. Those are called the turbinates. In some cases, due to allergy, the turbinates, the mucosa of the turbinates may be inflamed or enlarged. So that is also seen by endoscopy. We do a normal X-ray to find what is the issue in the sinuses. But then the gold standard investigation of choice for diagnosing sinusitis is CT scan. When talking about the chronic sinusitis again could be due to allergy or infection if it is lasting more than 120 days. So see, allergy can cause hypertrophy of the mucosa in the sinuses, causing polyp formation. So sometimes these polyps can block the opening of sinus and block its drainage and causing a permanent sinusitis. So if the patient can have intermittent relief, but still patient will have the symptoms and signs of sinusitis throughout. So the treatment for this all varies. Again, this is diagnosed by a nasal endoscopy, X-ray and a CT scan. The causative organism of the sinusitis is mostly viral, or it could be bacterial as well. As I told before, it could be allergy as well, and in some cases there could be fungal invasion causing fungal sinusitis. So now coming to the treatment of sinusitis, there are 2 modalities of treatment. There is a medical line of management and a surgical line of management. The medical line of management, generally the aim is to reduce the swelling of the mucous membrane of the sinus, so that the natural ostia opens, the natural opening of the sinus opens and the drainage happens normally. So for that, I tell the patients to do some lifestyle changes, eat good food, vitamin C rich food, so which can improve via mucosal healing, take steam inhalation to open up the sinus and for a better drainage of the mucus, drink warm water every day. All that can improve the sinus function. And we give sometimes saline sprays, flush out saline into the nose to flush the mucus outside, and we give medical drops or medical sprays which can decongest the lining of the sinus and the nasal cavity for proper drainage. And now if it is allergic, we generally prefer steroid nasal sprays, because these the normal decongestant nasal sprays cannot be taken for a longer period of time, because it is harmful, because it can cause it can worsen the condition if you use it for a long period of time. I have seen people taking this if I can say Otriven, that is actually xylometazoline nasal drops. They use it, they buy it over the counter and use it like for months together, and which is absolutely wrong, which should not be done. Because it can actually, you can become dependent on that medicine, and also that can worsen the symptoms in future. So generally we give in chronic sinusitis and polyps, we give steroid nasal sprays. Like in asthma we give steroid sprays. The same way for allergic rhinitis we give, or allergic rhinosinusitis we give steroid nasal sprays, it is not harmful. You can use it for a long period of time. If it is allergy, we give antihistamines as a supportive treatment. If it is infective sinusitis, it is bacterial sinusitis, we give antibiotics. Now, so this is the treatment for acute sinusitis. Generally patients improve with this, with the lifestyle changes and with this common medications which is given for acute sinusitis. Patient improves, but in spite of using all these, some patients might not improve because they might have an anatomical deformity in the nose. They might have a deviated septal bone, the central bone which divides the nose into two, the nasal septum. They can be a gross deviation. As I told, the side bones, which is called the turbinates, they can be hypertrophied, or they can be polyp formation, or they or in the other reasons where the sinus is blocked completely, permanently. In these cases, even if you use medicines, it might not be useful. In these cases, surgery is an option. So now, talking about surgical treatment of sinusitis, in olden days, actually the surgery of sinusitis has improved leaps and bounds in last 20 years, or if to be more specific, in last 10 years, it has improved like anything. And because in olden days, sinusitis surgery, it was just the antral wash, that is just a normal wash where the maxillary sinus, a long needle or a long rod used to be inserted into the nose and used for washing the sinuses. So, but then now it is no longer used because it is not a long-standing treatment. The symptoms generally comes back very quickly. So now with the advent of endoscopes, there is something called the functional endoscopic sinus surgery, which is done for the treatment of sinusitis. And as the name suggests, functional endoscopic sinus surgery, a surgery done with using endoscopes, maintaining or keeping the functions of sinuses intact, is functional endoscopic sinus surgery. So here the anatomy of the nose is not disturbed, only the natural opening is widened, all the mucosal secretions are sucked out, and the natural openings is widened so that it doesn't get blocked again. So this is the main basic concept of functional endoscopic sinus surgery. Now there are newer procedures called the balloon sinuplasty, which is done across the globe, where a balloon is inserted into the natural opening of the sinuses and it is inflated so that the natural opening widens, so that there is proper drainage of sinuses. So this is again a daycare procedure. The patient comes in the morning and evening, he goes. Before we used to have this nasal packing because there was a lot of bleeding in certain cases, certain surgical procedures. In balloon sinuplasty, there is no problem of that. So there is the nose is generally not packed with cotton. So many patients have told that that is a traumatizing experience. So all that can be avoided using this surgery. So basically, with the proper drainage, the sinus regains its function and patient becomes okay. So this is the basic treatment for sinusitis. Now, what are the preventive measures? A lot of patients ask, what are the preventive measures? So I generally tell steam inhalation every day. You have sinusitis or no, take steam. This will generally, whatever clogged secretion is there, it will come out. And in case you have sinusitis, I generally tell the patient, please do not blow the nose very hard, because that can actually exacerbate or increase the symptoms, don't keep touching your nose, because your hand is a major transmitter. It can transmit infection to others. Then lifestyle measures like eating good food, good diet, vitamin C rich diet, which will increase the mucosal healing, and it is good for the mucosal health. Steam inhalation, then drinking warm water. In some places they also tell use a teaspoon of turmeric into the water and take steam, so that will also improve the sinus health. That is also acceptable. Even if you don't have the turmeric or you don't use it, you use plain water steam inhalation, that's enough. So with all these measures, I think you can prevent sinusitis. But then if you have sinusitis, it is best to consult a doctor, because generally it is a neglected disease, because a lot of people think it's just a common cold, a cetirizine is enough and it is over. But then sometimes if you don't take this seriously, and it might just go into some complications and become a complicated sinusitis, which is very tough to treat, because complicated sinusitis, you can see around the nose there is eyes, brain, so this infection can easily go into the eye, go into the brain, causing orbital cellulitis, causing brain abscess, cavernous sinus thrombosis, and many deadly diseases. So whenever in doubt, more than 10 days the cold is persisting, it is not reducing, you have this headache, you have this pressure in your head and which is not going, better consult an ENT doctor and get the sinusitis treated as soon as possible.